Scientists are learning more about this disease every day. That, combined with a shift in how the state is managing COVID-19, has led the state to change the definitions of what is considered an active and recovered case. This has resulted in confusion, not just for some health officials, but for our viewers. NBC5's Madison LaBerge explains.
Educating people on what these numbers really mean really helps.
At the end of June, the Oregon Health Authority changed the definition of a recovered case of COVID-19. Health officials stopped calling to track patients' recovery and put more effort into tracing. Jonathan Modi with OHA says, our epidemiologists are using the time that had been spent on assessing recovery to perform case investigations and contact tracing. After the change, positive cases were deemed recovered if the patient was still alive 60 days after diagnosis. The move was met with some consternation. Klamath County Public Health came out publicly disagreeing with it.
That's incredibly misleading because it looks like people are not recovering or that they're much more ill than they truly are.
KCPH Director Jennifer Little releasing this statement. It's an unfortunate change because from a community service perspective, it artificially inflates active cases. The new process no longer provides a direct correlation between the length of illness and recovery. Our own medical expert, Dr. Robin Miller, a general internist, agrees.
If someone's tested positive for COVID and it takes 60 days to be recovered, that makes no sense to me.
She prefers the active case numbers, though not every southern Oregon county provides them, including Douglas, Coos, Klamath, and Lake counties. One Jackson County epidemiologist tells us the definition of active also varies county by county. Bailey Burkhalter told us via email, quote, Klamath County associates active with recovery and as such doesn't report active cases at all. Jackson County, however, essentially equates active with the discontinuation of isolation, end quote. Jackson County Public Health Officer Dr. Jim Shames says the terminology is perhaps most useful from a public health perspective.
I appreciate that it's confusing, and I may even be confused by some of the terminology.
But he says county health agencies are working on the public's behalf to keep them safe.
I suspect that some of this has to do with people that feel like there's an exaggeration that's happening, and that perhaps somebody somewhere for some reason is wanting to make this seem bigger than it is. For those of us that are actually hearing the stories and watching people get hospitalized and dying, we had a fatality yesterday, seeing how it all connects, it's all very real to us.
In Medford, Madison LaBerge, NBC5 News.
The OHA says during the week of August 23rd to 29th, 4.4% of the 26,000 plus Oregonians tested for COVID-19 came back positive.